Hello and welcome to Business Insider with Mario Toneguzzi on YYC Business. Joining me today is Paula Allen, who is Global Leader and Senior Vice President of Research and Total Wellbeing for LifeWorks, formerly Morneau Chappelle. Thanks for joining us today, Paula.
Oh, it is a pleasure.
Well, the company put out its monthly mental health index today for April. Again, it shows a negative mental health score for the 13th straight month. No surprise there, I guess.
No surprise, but it is certainly, even though it's become the norm, it's not a good norm to have.
Yeah.
We are seeing a little bit of an upswing, a little bit more optimism, particularly driven by vaccinations and the, people's feeling about that when they actually get a vaccination. But there's no question about it. We are not out of the woods yet. This has been going on far too long, for my view, but also the longer we're under stress and upheaval, the longer it actually takes for us to get back to where we were. And in some cases, we won't get back exactly where we were.
Yeah, and you did mention there was an improvement from March. I guess that's a pretty good sign, right?
It is. We've seen that trend. And again, it is largely driven by hopefulness that we will get back to some level of normalcy. But when you look at it as a trend, we've gone from a negative 11.7. That was the score that we had in April of 2020. And April of 2021, the score is negative 10.7. So it isn't a massive jump and isn't a massive improvement. But directionally, it's in the right direction.
Okay, let's talk a little bit about the vaccines. Do you expect that mental health score to improve in the coming months simply because more and more of the Canadian population is getting vaccinated and there are easing of restrictions? I know in BC, here in Alberta, we've saw yesterday an announcement of gosh, in Alberta, they're talking early July, basically getting rid of all restrictions if everything continues on for vaccination. So sign of hope there for the future?
It's a sign of hope. I mean, the number one thing that people said that would improve their outlook if they themselves got vaccinated, which is very interesting. It is around, just removing that cloud of personal risk. So that was number one. Second to that was herd immunity. So basically, something happening in our society where COVID is one of the major factors that are determining what we're doing. And then further down the line was reopening. So it really, people are very concerned about this virus, and they know that other things are related to it, but it is number one, being personally vaccinated and that herd immunity. I think though that after that happens, how things happen, you get elated when something happens that you want to have happen, and then you move forward in a steady state. So I do think we have to remember that a lot of people are going to have a long climb back in terms of just feeling comfortable in society and how we're moving forward. And it'll happen, but it's not going to happen overnight.
Yeah, exactly. Now, one of the things that the report mentioned was the fact that many Canadians, almost half, want mental health support. But there's a big but there, is affordability is a concern. Can you talk a little bit about that and what's happening there?
Yeah, this is one of the things where we can never take anything for granted. We have to ask the question. We have to understand what's going on in people's minds. And because I think a lot of the people who would say affordability is an issue, they might be looking at a particular path where there's a challenge in terms of affordability. But in Canada, we have many paths. The mental health index is populated by people who are working. It's a measure of working Canadians. And a good portion of working Canadians have access to employee assistance programs, which is completely free to the individual. It's sponsored by the organization, it's voluntary, it's confidential. We also have health benefits. There's public health things. Like again, in Ontario, we have MyICBT in Manitoba as well. Some of the other provinces have other programs, but it is a bit confusing. So people might not understand what's available to them.
Yeah.
And I think that's where we're getting this response.
Okay. The only other thing I wanted to ask you, Paula, and I don't know if the report looks at it, but maybe it's more anecdotal from your part. When you look at the state of the mental health in Canada right now, are there any segments of the demographics that are more particularly hit hard when it comes to mental health than others?
Yeah, we found a few, depending on what aspects you're looking at. Post-secondary students, so the first one that comes to mind, they have been very much hit hard by this pandemic. A very vulnerable point in life, really very important to have social support and connections with your peers. A lot of uncertainty, a lot of the part-time jobs that they were working were into industries that really went away during the pandemic because of restrictions. So a lot of issues there. We've also seen parents, much more impacted than non-parents. And, as wonderful as having children is, you can double your joy, but you're also taking on the anxiety and the responsibility and the disruption in terms of what's happening with school situations. And then parents of any age, of any age children. And the other groups that we've seen quite hit a certain industries, accommodation, food services, and people have had their income reduced. So financial well-being is actually a big issue as well.
Yeah. Okay, super. Well, thanks very much, Paula, for joining us today.
Always a pleasure.
All right, that was Paula Allen, who is Global Leader and Senior Vice President of Research and Total Wellbeing for LifeWorks, formerly Morneau Chappelle. This has been Business Insider with Mario Toneguzzi on YYC Business. Thanks for joining us today.